Okay. So we're going to talk this evening about understanding sleep and how it impacts your cancer, your treatment, and your treatment outcomes. And if you are having difficulty managing sleep, what are some ways to maybe help improve that a little bit to help better improve your treatment outcomes if possible. So just a little about the cancer support community. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. So if this is your first time participating in a cancer support community event, we welcome you and we encourage you to reach out to us to find out in what other ways can we support you with your cancer experience. This evening, your presenter is Jennifer Dunn, and I have no financial relationships or affiliations to disclose. I do have to let you know that this workshop was developed by the cancer support community, and our content is independent. It was developed independently and with the assistance of outside psychosocial experts. We have control over the content in our programs, and I am a facilitator at the cancer support community. I'm also an oncology social worker in the community as well.
And Jen, just so you know, you're not sharing your screen right now.
I'm not. I'm so sorry. Can you see that now?
Yes.
Okay. So an overview of this evening is we're going to talk about the importance of sleep and how it impacts your cancer care or your cancer treatment, how cancer can impact your sleep cycles. What are some ways to better optimize your sleeping practices, and when to talk to your healthcare teams, or maybe what questions to ask them when it comes to your sleeping habits. So first, we're going to talk a little bit about the importance of sleep and the benefits of getting a good night's rest. So the overall thing to remember is that sleep plays a pretty pivotal role in your overall health and well-being. It helps protect your mental health as well as your physical health, and can improve your quality of life and your safety overall. It helps your brain work properly and helps prepare you better for your next day by forming new brain pathways. It helps you to better understand and retain information, and can overall impact your mood control, helps control your emotions and your behaviors, and impacts your decision-making and problem-solving capabilities. In terms of your physical health, it can help not only boost your immune system, keep you healthy, it helps manage your blood sugar levels, helps keep your blood sugars low, and it helps balance your hormones, keeping your hormones in a safe range. So just some overall statistics on sleep when surveyed by, when cancer patients are surveyed. It is reported that somewhere between 30 and 75% of cancer patients have difficulty sleeping. And that's a pretty large percentage of the population, if you think about it, that over a third, if not almost 2/3 of people impacted by cancer report having trouble with their sleep. And almost half of those individuals reported moderately to severely being moderately to severely concerned about their sleep problems. And as a result, people reported a worse or overall worse quality of life related to these sleep disturbances. So what are some ways to kind of identify what are some sleep disturbances that maybe you're experiencing? You first of all want to look at what are maybe some different changes, what are your normal sleeping patterns, and what are some changes that you're seeing related to those sleeping patterns? Are you noticing any difficulty falling asleep at night? Maybe you've got some ruminating or worrying thoughts that are keeping you awake and not helping you fall asleep like you normally would. Are you tossing and turning more, waking up more in the middle of the night, and having difficulty falling back asleep as a result? Are you finding yourself taking naps during the day? And sometimes are they getting more frequent in pattern? Are you noticing that they're getting longer throughout your day? And are you noticing any difference with your mental capabilities? Are you able to focus and concentrate on the activities that you're doing? Are you finding that you're waking up at earlier hours in the morning and not being able to fall back asleep? Sometimes people will wake up at 3 or 4 in the morning and they find that they're awake for several hours and have trouble falling back asleep. And then they fall back asleep and then they're kind of groggier through the day. Are you having any trouble with your breathing at night, like snoring or making any kind of gasping for breath? Maybe you're stopping breathing in the middle of the night. So it's important to notice any patterns that are becoming consistent for you with your sleeping. So one thing to keep in mind is that fatigue is the most commonly reported symptom or side effect of cancer treatment. It is, I've had individuals explain it to me as a different type of fatigue than they have experienced before. I've had one person explain it to me as almost like a crippling fatigue, where they have felt like they only had the energy to get up out of bed and maybe move to the couch for the day. So it's an extremely common experience among people who are going through cancer care. And we'll go over a little bit more of why that is. But some things are experienced as fatigue, which is just feeling overly weak and more tired than you usually are, maybe feeling like you have to rest and sleep more than you typically would. But another sleep disturbance is insomnia, or just having trouble getting to sleep and staying asleep. And about 30% of cancer patients report experiencing insomnia at some point throughout their care. And then finally, just irregular sleeping or wake cycles. And this is kind of that experience where people are maybe mixing up their days and nights, where they're sleeping more throughout the day, causing them trouble sleeping at night, maybe because they're napping, they're fatigued and they're napping more throughout the day. And then they're rested, so they're not sleeping well at night. So some of the things that contribute to sleep or can impact your sleeping patterns are a number of things, but one thing to start with is looking at the treatment or the medications that you might be taking. Oftentimes, many of the side effects of the treatments that people receive can contribute to your sleeping patterns. I don't know how many people take steroids with their treatment, where maybe they're, if you're taking steroids for several days, you might experience kind of that steroid high, and it really impacts your ability to sleep. Or sometimes people find that their medications have side effects where you have to get up and use the bathroom multiple times a night, or maybe they make you nauseated and it's causing problems with your sleep. So treatment can often be a major impact on your sleep. If you've ever had to stay overnight in the hospital, where you've had to have your vital signs or medications or sometimes blood work or things done in the middle of the night where they're coming in and they're disrupting your sleep for a multitude of reasons, and it's causing you difficulty sleeping. If you experience any kind of cancer-related pain, cancer-related pain can certainly keep you awake, especially if it's not being controlled well, or is new or sudden onset pain could certainly keep you awake. And then overall, general just fatigue can have an impact on your sleep. Some people find that, again, a lot of these medications can make you drowsy. On the flip side of keeping you awake at night, they can make you drowsy. The fatigue can make you feel like you have this need to go to sleep, to go lay down in bed, and people find that they're taking long naps throughout the day. Maybe they're sleeping more than they usually would, or again, that pattern of sleeping more during the day and less at night. And then finally, your mental health can certainly have an impact on your sleep. Oftentimes, some of the symptoms of depression and anxiety are changes with your sleeping patterns. Many people who are struggling with depression find that they're up early in the morning, sometimes 4 o'clock in the morning, and have a very hard time falling back asleep. Or if you're experiencing any kind of untreated anxiety, where maybe you have a lot of worrying thoughts that are keeping you awake, and kind of help making it difficult for you to wind down at night so that you can get restful sleep. So anytime you're noticing any new side effects, you certainly want to talk with your healthcare team about, are there different ways to manage some of these side effects? Oftentimes there are different, I certainly know that you probably take a lot of medications, but sometimes there are medication options that can help with those side effects. Chemotherapy and radiation and surgery and all of those different types of treatments can have an impact on causing increased fatigue. If you've been through radiation and maybe you're experiencing some slight burning on your skin, that could cause some pain, that could be discomfort and keep you awake. Or chemotherapy like I said, that number one side effect of chemotherapy is fatigue related, and can make that difficult to stay awake during the day. Anemia is another side effect that could impact your sleep. And oftentimes when people are getting chemotherapy treatment, what people find is that chemotherapy not only affects your bad cells, but it can also affect your good cells. And if your treatment is in a position where it destroys too many of your healthy red blood cells, it can interfere with blood production and actually cause blood loss, which could lead to more fatigue. And we do have ways to manage that if you're experiencing anemia-related fatigue. And then finally, just medications to treat pain. Keeping in mind that a lot of pain relieving medications can cause extra fatigue. They can make you sleepy. If you're having significant pain and you're having to take a lot of medicine to get it under control, you might find that you're sleeping more than your typical sleeping pattern. Some tips for hospital stays. If you find that you have to stay overnight in the hospital for any amount of time, I probably don't have to tell many of you that you've probably been in the hospital and you know what it's like to try to sleep or stay overnight in the hospital. It can be very disruptive, and a lot of people find that they don't get good rest while they're there. So just some things to keep in mind is to bring items that bring you comfort. So that could be pajamas, it could be your pillow. Like if it's certainly if it's a planned hospital stay, you might consider things that block out the light, like maybe a night mask or headphones, something that might help bring you comfort so that you're feeling a little more like at home. You want to be mindful of the light in the room and think about, during the day, having your blinds open so that natural light is coming in, and your body can adjust to the sunrise and the sunsets, and then keeping the blinds closed at night so it stays dark in the room. But that can help kind of maintain your normal sleeping schedule. You can ask for medications or your treatments to be administered during the day, so they're not waking you up in the middle of the night to administer those medications. And then you want to try to stay as much on your sleep schedule as possible. So just some different reasons that pain may be causing challenges to your sleep or changes to your sleep is first of all, in many cases, people can experience pain from the cancer itself. So if there is a part of your body that you're noticing that maybe you sleep on your side, and maybe that's the side that your cancer is located on, it may be more painful to sleep on that side for a period of time. If you've had any major surgeries, such as maybe you've recently gone through a mastectomy or some kind of breast cancer related surgery where it's difficult to move from side to side. Maybe you've got drains from your surgery. It can be very difficult to get comfortable and to get good rest during that time. If you happen to have a type of cancer where you have a part of your body that's been removed, maybe you've had a leg removed or a limb amputated, and you can experience phantom pains as a result. And then treatment, side effects, and procedures and testing are some of the things we've been talking about. You might find that pain it's very possible that pain may wake you up in the middle of the night and could make it more difficult for you to fall back asleep. Oftentimes this is because either pain medicine has worn off, or maybe you've moved in your sleep and you've ended up on that side where your cancer happens to be located, or there's some new pain that has started. So you want to talk with your doctor about, what is the best way to manage your pain? And are there options other than, just medication management? Are there other integrated options that we could look into as well? So if you're experiencing significant pain that is certainly impacting your sleep, we encourage you to speak with your doctor about that. And again, going back with fatigue, fatigue is the number one identified side effect from cancer treatment. And this is it's going to vary based on the type of cancer that you've been diagnosed with, the type of treatment that you're receiving, and kind of where you are in your treatment plan. So about 4 out of 10 people indicate that fatigue symptoms, patients indicate fatigue symptoms worse than the national average. So about 40% of cancer patients. 50% of patients report that they were moderately to severely concerned about sleep problems. So if you are somebody who is concerned about how you're sleeping and how cancer has impacted that, you're certainly not alone. It's about half of people have reported that. So just some tips on how fatigue, on how to help improve fatigue and maybe help impact your sleep a little bit more. So just some things to consider is maybe conserving your energy. You want to identify what are kind of the most important things for you throughout the day, or if you have a big event coming up throughout the week, that you want to have energy for. Are there ways that you can identify what are kind of the most important things for me, and start to keep track of what are the times of day in which you feel the best, and can you try to plan these activities that are most important to you during this time of day where you feel the best. So you're sort of conserving your energy for those activities that you find most important to you. In order to maintain your energy, you want to think about drinking a lot of water, make sure you're hydrated, that you're eating well, and that you're doing things like avoiding too much caffeine or alcohol. You want to make sure that when you have those times of days or those days where you've got that energy, you want to maintain that energy. And then you want to think about moving your body. Light exercise is encouraged throughout your week while you're getting treatment. This might help preserve your energy levels. I always think about physics when we say an object in motion stays in motion and an object at rest stays at rest. If you can get up and kind of force yourself to get moving slowly but surely, you will find that you will kind of continue that movement throughout the day. It can help kind of preserve that energy for you. And then utilize or practice any kind of relaxation techniques. Things like deep breathing exercises or body scans and meditation can really help to calm the body and ease the mind, and can help facilitate good rest as well as conserve energy. And then mental health is something that I think oftentimes gets overlooked when we talk about cancer care. We're so focused on treatment options. And I think a lot of people find that when they're newly diagnosed, things just move really quickly and it can be very overwhelming. And it's not until later in treatment that people finally get some time to slow down and think about, my body has been through a lot, and maybe I haven't had time to process all of this. And so oftentimes people experience a lot of what we in the cancer world identify as distress, or just some depression and anxiety that could ultimately be impacting your ability to sleep as well. And insomnia is certainly something that can be a result of having unresolved worries and concerns, and that focus on a lot of the unknowns that come with the cancer diagnosis. So we highly encourage people to also be not only addressing physical health, but also looking at emotional well-being and quality of life, and how can we help better address any maybe untreated anxiety or depression that people are experiencing. So in kind of going back to that, almost half, 49% of respondents were at risk of clinically significant levels of anxiety, where 38% of respondents were at risk for clinically significant levels of depression. So if you find yourself feeling, extra anxious, having more kind of those rolling thoughts of worry, and or maybe you're feeling more sad or depressed, you're certainly not alone in that experience. So we do know that sleep does significantly improve individuals' mental health, and vice versa. We know that there's a symbiotic relationship there where if you're not getting enough rest, it can certainly contribute to depression and anxiety. However, depression and anxiety can also contribute to difficulties with sleeping. So if you're thinking about, maybe I need to talk with somebody, certainly bring it up with your healthcare team and see what kind of support services they can connect you to. Okay, so here's just they give us a break in the presentation just to take a few minutes to think about how your sleep has been impacted so far by your cancer diagnosis. And I also thought this would be a good time that if there were some questions, it certainly can answer any of those questions, or if there's any thoughts that people want to share, we can do that. So I might give you just a few minutes to think about how cancer has affected your sleep at this particular point in your care. So if you want to take 2 or 3 minutes, and then if anybody has questions, you can put them in the chat.
Also, Jen, there is an option. There should be like a raise your hand thing that you guys can click on. And if you click on that and we see that you have a question, we can also unmute you and you can say it out loud if you don't want to put it in the chat as well.
So far, it doesn't look like anybody has any questions. Would anybody want to share? Just would anybody be open to just sharing any difficulties that they're having, or kind of how their sleep has been impacted? If you feel a desire to share that, it would be welcome. Okay, so just some ways to think about how to optimize your sleep practices. Oh, I do see something in the chat.
Jen, do you want me to read them to you?
Yeah, if you wouldn't mind, because I have to scroll through all of them.
Yeah. So one of the questions says, any suggestions on getting comfortable with abdominal pain at night?
I don't, it's specific. It sounds like it's specific to your abdomen, and I think it's probably best if it's, if you're having specific pain related issues, that it's probably best that you speak with your treatment team about that to see, are there some ways that we can better keep you comfortable and maximize your comfort care in order to help you get better sleep. I think since that's kind of directly related to your pain, it's probably a good idea to bring that up with your care team and just make sure that, that they're aware that you're having that, and that, that you've got the optimal pain control plan for you.
And then the other one says, how long after treatment has ended do sleep issues usually continue? I finished active treatment 9 years ago, but was left with side effects from treatment, which I believe have impacted my sleep.
I mean, absolutely. I think the challenge with cancer treatment is that, some of these side effects or some of the changes that people experience physically can be lifelong changes, unfortunately. If you can identify, what it is that is contributing to that loss of sleep, is it, are there ongoing anxiety or depression that maybe hasn't been addressed that maybe you could explore, or if it's something that you haven't addressed with your physician yet, maybe they could look at, are there medications that you're taking that have that as a side effect? If there's long-term medications that you're required to take that maybe need to be reviewed, certainly discuss that with your doctor. But I think, unfortunately, that there's no time frame in terms of when this will improve. It's kind of a matter of what are some of the long-term effects that maybe you've experienced from your treatment. So maybe just looking at some ways to optimize your sleep practices and maybe try to help get some improvement. We can look at that and give you some skills to maybe try to help improve your sleep patterns. So something we know is that any changes in your health practices plus changes in any environmental factors can lead to better sleep hygiene. So maybe this can kind of go back to answer that second question a little bit, is kind of looking at what are some things that are maybe contributing to not only your health practices, but your environmental factors that maybe we can give you some skills to make some changes and to improve your sleep hygiene. So some things to think about is you certainly want to look at setting up your sleep schedule, improving maybe a nightly routine, looking at your habits and cultivating maybe some healthier habits, and looking at things like improving your bedroom. So just to think a little bit about your current sleep schedule, I think one thing to consider is looking at, do you have a fixed time that you go to bed, and do you have a fixed time that you wake up every morning, or do you allow kind of your body to naturally fall asleep when you're tired and wake up when you're finished? You want to look at having maybe kind of a fixed wake up time, because that will kind of start to train your body to recognize, this is the time that I get up, and it gives you that energy throughout the day. And then you've got sort of that fixed time when you're ready for bed. And then you want to look at prioritizing sleep. Sometimes we want to go out and have dinner with our friends and maybe stay out for an additional time. I'm thinking about like in a pre-pandemic time, but sometimes we want to have those later nights, but recognizing that if we're trying to prioritize our sleep and really get ourselves into a sleep pattern, we want to make sure that we're staying to a consistent sleep schedule. And you want to think about making gradual adjustments. If you're someone who's used to kind of sleeping in later in the day, maybe you sleep till 9 or 10 o'clock at night in the morning, and you're thinking, well, I really want to get my sleep schedule set up. You don't all of a sudden want to set your alarm for 6 a.m. when your body's used to waking up much later in the morning. So you want to kind of make gradual adjustments, thinking like if you're used to waking up 9 or 10, maybe you set your alarm for 8:30, 9 o'clock. And then you kind of get used to that. And then you gradually set it for a little bit earlier in the morning. you don't want to make too many drastic changes because it's difficult to form a habit that way. And then you want to think about trying to reduce how much you're napping during the day, which I recognize can be really difficult for people, especially when you're going through treatments that can really make you fatigued. But think about how napping can sometimes really impact your ability to sleep at night. So if you're reducing how much you're sleeping during the day, you're letting your body get its full rest at night. And then you want to create kind of a nightly routine for yourself. We live in a digital era where we have cell phones at our disposal, and I think many people find themselves at night kind of playing on their phone or their computer, and can make it really difficult for our bodies to wind down. We've got constant light being shown in our eyes, and so you want to think about limiting, when you start to think about what time am I planning to go to bed, how much before that do you need to think about doing things like turning off your cell phone or kind of starting to wind down a little bit. So you want to kind of build yourself a window of time where you've put your phone down or you've turned the television off. And you want to start to kind of create an atmosphere where your body starts to recognize, like, okay, this is time where I'm going to start winding down and start getting to sleep. So you want to think about the setting. You want to maybe dim your lights, unplug your electronics, maybe some of you might decide that taking a bubble bath or something to help you kind of relax for the evening, it can become part of your routine. Maybe you're going to pick up a book for 30 minutes or spend some time journaling before you go to bed. So it's kind of creating a practice and developing some consistency in what your bedtime routine looks like. I think if maybe you've had children, you may have had a routine for them that helped kind of prepare their bodies to know, okay, it's time to start winding down and get quiet and allow our bodies to relax so we can fall asleep. And it's the same with adults. We can benefit from that same routine. And I have here get up and try again, because we all know that habits are hard to break. And so it's something that you want to continually try if you have to. It's a good time to start thinking about taking any medications that you need to take. Like if you're experiencing that cancer-related pain, do you need to take that medication, within a certain time frame, so that you don't have to wake up again in the middle of the night to take more pain. So you're taking your medication 30 minutes to an hour before bed, so that you're reducing that possibility of increased pain while you sleep. And then you want to think about the different habits that you have, and think about what are some ways that you can incorporate some more healthier habits to better improve your sleep practices. So I think we live in a culture that keeps us kind of fast and moving and busy at all times. And maybe we don't recognize when we're feeling exhausted or tired. And I think listening to your body is really important. And if you're starting to feel sleepy, then that's a good indicator that maybe it's time to go to bed. So if you find yourself listening to your body and you're feeling really sleepy, listen to your body and let yourself get some rest. Oftentimes we know that activity during the day can improve your sleep at night. Exercise can improve your sleep. So if you're staying active and you have maybe an active routine, like a daily routine of I'm going to take a walk around the neighborhood or take the dog for a walk or something like that, that can help actually improve your sleep at night. You want to think about your caffeine and your alcohol consumption, and at what points of the day are you consuming those beverages or those substances. I personally am extremely sensitive to caffeine and know that if I have a cup of coffee after 11 o'clock in the morning, I'm not going to sleep all night. So think about how much caffeine or alcohol maybe you're consuming, and start to think about, do I need to look at giving myself a cutoff point throughout the day where, or do I need to cut these out completely? If you've noticed that maybe it's really impacting your ability to sleep. And then eating and drinking before bed. I think a lot of people are aware that if you drink too much before bed, then you're up all night having to use the restroom. So you want to think about at what point do you need to limit yourself to drinking before bed, as well as eating. Our bodies continue to function at night, and we find that our bodies are going to continue to digest food and things like that, and it can actually disrupt your sleeping pattern. So you want to think about how much you're eating or drinking right before bed, to maybe limit the number of times you have to get up at night. And then again, exercise during the day. This says at least 4 hours before bedtime. You want to think about how much you're exerting in your exercise. Are you, you're getting your heart rate up significantly for any amount of time? Because once your heart rate is elevated, that can continue for an extended period of time. So you want to think about doing your exercise maybe earlier in the day, so that you're not getting your heart rate up too high right before you're getting ready to go to bed, because it's going to impact your ability to sleep. And then you want to think about, what are the things that you're doing in your bed? It should be limited to certain activities. This is where I bring up, people scrolling through their phones or watching TV. If you have a television in your bedroom, is that preventing you from falling asleep, or if it's on all night, is it waking you up at night? So you want to think about, the bedroom is limited to sleep, and make sure that the environment is set up for that. And then you want to just think about your bedroom, the environment where you sleep. Are you comfortable in your bed? Is your mattress comfortable? Is it the right mattress for you, the right pillow for you? Are you finding that you're waking up feeling stiff or pain, muscle pain, neck pain, things that maybe that your bed and your bedding are contributing to? And there is some research that indicates that cooler temperatures actually help us get deeper sleep. So sometimes if you have a smart furnace, you can or thermostat, you can set your thermostat to lower the temperature to cooler in the evening, because it actually, as your body temperature drops, you actually get deeper sleep. So if you're if you think about how temperature impacts you, you might consider maybe lowering the temperature in your house at night before you go to bed. You want to be able to block out as much light as possible, because any light is certainly going to indicate to your body that it's time to wake up. So if you live in an area where there's a lot of lights outside, or maybe you're trying to go to bed a little bit early and the sun is still out, you might consider getting blackout curtains for your room. Making sure all the lights are out in your room, but making sure it's a dark environment so that your body isn't naturally thinking it's time to be up. And then you want to drown out as much noise as you possibly can. Some people have noise machines, like white noise machines, or I know some people have fans so that they like box fans or things that they will keep on at night, just to kind of drown out any other noise that might be happening around them, especially if you live in a city and there's cars driving by or ambulances and things like that. Okay. I'm going to take just a few minutes to do just a short mindfulness exercise. And the reason for that is I want people to have, if you've never done a meditation or a mindfulness exercise, it's an important tool to have on days where you might be struggling with just a lot of, what we refer to as ruminating thoughts, where your brain is just kind of filled with different worrying thoughts that you're having a hard time calming your brain down. And this can really contribute to a person's inability to fall asleep, to stay asleep, and get back to sleep if you wake up in the middle of the night. And so it's helpful to have some tools in your pocket to just kind of help calm your mind a bit. And so I thought I would just go over just a short breathing mindfulness exercise with you, just allowing your body to focus on your breath and away from maybe those thoughts running through your brain. So I encourage you, if you want to participate, to find a position that's comfortable for you and to close your eyes or gently look down at the floor. And just do whatever you need to do right now just to feel comfortable in your space. If that's to put your both feet on the floor, and take a few easy, slow breaths. And with each breath, try to release any tension you notice in your body. Where are you holding your tension? Is it your shoulders? Is it your neck? And just breathe into those parts and release any tension that you notice there. And just start to notice your breath. Feel your stomach rise as you breathe and lower as you breathe out. Notice the rhythm of your breath. It's natural for your mind to begin to wander. You might have thoughts about your day creep in, questions about your pain or your medications. But as these thoughts creep in, just gently remind yourself to focus on your breath. Come back to your breathing. Feel your belly rise as you breathe in and lower as you breathe out. Stay focused in this moment, just gently breathing and connecting with your breath. And anytime those thoughts creep in, just come back to your breath. And allow yourself to feel any emotions that are coming up. And just be present with yourself. And you can slowly open your eyes and come back to the present moment. So that's just a little bit about a little exercise you can use. When we focus on our breathing, it kind of takes us out of our mind for a minute and brings us back into our body and reminds us that anytime we're feeling anxious or overwhelmed, or we have a lot of worries or a lot of things to carry, that we can always come back to focusing on our breath and just give ourselves a moment to relax and just be present with ourselves. So if you find yourself in that moment, or if you're laying in bed and you're trying to sleep and you've got a lot of thoughts running through your mind, just start to focus on your breathing. Start to pay attention to, am I breathing quickly? Can I take some deeper breaths? And can I help calm myself down and let those thoughts pass and just focus on my breath and see if that helps. It helps you get back to sleep. Okay, so finally, just talking a little bit to your healthcare team. So just kind of going back to some of our statistics here, 44% of cancer patients reported a sleep problem in the previous month. But only about 17% of those individuals actually communicated the problem with their doctor. I think most healthcare teams would probably say that, that they don't want their patients to feel like they have to accept the circumstances of their treatment side effects. That, if you're struggling, or if you're suffering because you can't sleep or because you're just so fatigued, please talk with your doctors about what you're struggling with, and can hopefully help come up with a plan for you. And here are some questions to ask. If you're not sure how to bring it up with your team or what to ask, you can certainly just ask them, can they give you any indication? Why are you having trouble with your sleep? And what are some things that you can do, some steps you can take to sleep better? Are there recommendations that they have? Would they recommend a sleep therapist who could help with problems? There are, if you're really finding that your pattern of sleep is off, and you've got your days and your nights mixed up, or, you're having some pretty significant insomnia, there are, sleep specialists that you can be referred to that could potentially help resolve some of that. And then would they recommend you taking any kind of medication to help with your sleep? If you're really struggling with, anxiety, is there medicine that you can take in the evening that would help kind of calm some of that anxiety and make take that edge off so that you can get some better rest? I always encourage people to ask, what are my options? What are some things that I can do to, improve my quality of life? And remember that, if your doctor, if you're not bringing, going back to that 17%, if you're not bringing it up with your doctors, they don't know that you're struggling in this way. And so that's why we encourage you to please reach out to them. So just some different interventions that are available. Certainly if it's related to depression or anxiety or just cancer related distress, and you feel like it would be helpful to talk with somebody about that and maybe develop some skills, or have that opportunity to have someone that you can share your experience with, you can explore any kind of counseling options that might be available. A lot of the cancer centers in the area have counselors on staff that you can be referred to, and many of them provide counseling at no cost. Certainly there are support groups available at the cancer support community where you can connect with others who are maybe experiencing a similar difficulty, that you can kind of share you know, have that shared experience with, and even maybe get some, you know, this is what helped for me. This is what, you know, this is what I did, and this is how it helped me. Could be a possibility. You could learn some different relaxation techniques or therapy options where you develop some skills, kind of like that brief mindfulness exercise. You can learn to do a body scan, which is kind of learning to mentally scan your body from head to toe and finding where you're holding tension and doing some relaxation techniques to help relieve some of that tension. There's also deep breathing exercises, meditation exercises. Yoga before sleep can sometimes be a good exercise to practice. And then if you're really struggling and none of these things seem to be working, are sleep aids appropriate for you? You know, that might be something to discuss with your doctor if you're really having side effects or things that related from other medications that you're taking. You know, steroids can really, you know, a lot of cancer treatment involves taking steroids. And so it can really wreak havoc on your ability to sleep. And so if you're finding that you're feeling overly stimulated because of the medications you're taking, certainly talk with your doctors about, are there things that we can do to offset some of this? Are there sleep aids that you can take that would maybe benefit you? And then finally, we just have some resources through the Cancer Support Helpline. The Cancer Support Community is a national organization, and our helpline is staffed by professional counselors Monday through Friday. That's Central Time, it's 8 a.m. to 8 p.m. Or you can check out mylifeline.org, which is one of the online communities that you can connect with as well. That Cancer Support Helpline is 888-793-9355. You can also reach out to your nurse coordinators through your physician's team, as well as if there's a social worker or a counselor on staff that they can connect you to. And then just a few more, these are just some cancer support community options. The Open to Options is a program through the cancer support community where if you're struggling to communicate or ask questions with your physician, you can sit down with one of the staff at the cancer support community, and they will kind of help you problem solve and kind of organize your thoughts and your questions to help you better, best communicate with your physician. So if you're struggling to communicate with your doctor about things like your sleep or your pain that maybe you're experiencing, or just things that you're aspects of your treatment that are maybe contributing to your inability to sleep, then it could be helpful to talk with somebody and kind of process that out a little bit to organize your thoughts and help facilitate that conversation with your doctor. Okay, and I think that's the end. Any questions or thoughts about sleep? I'm going to stop sharing my screen. Okay, so any questions or any thoughts on just those different skills or resources that were provided, or thoughts on just creating a better sleep pattern or hygiene or schedule? The number for the cancer support hotline, let me pull that back up for you. Here, I'll share that on my screen again for you. That number again is 888-793-9355. And if you're interested in an open to options, you can contact Haley can give you the contact information for the cancer support community before we go this evening. Any other questions or thoughts about sleep or things that other people have found helpful that maybe helped with their sleep challenges? Okay. Well, if there's no questions, that's all the presentation that I have this evening. But if you do have, other thoughts or questions or feedback, you can always contact Haley or Danny at the Cancer Support Community. I don't know, Haley, can you put the phone number for the Cancer Support Community in the chat box so that way they know who to contact or what number to call?
Yeah, I definitely will.
And again, if this is your first presentation with the Cancer Support Community, feel free to reach out to Haley or Danny. Danny's our program director there, and let them know kind of what other services you think would be beneficial or helpful for you and supporting you through your treatment. And we'll see what we can get you connected to going forward. Okay, well, if no one has any other questions, I think that's all for the evening. Feel free to reach out to us. The number is there in the chat box. It's 314-238-2000, and ask for Danny or Haley, and they will get you connected to other support services as well. Okay.
All right, well, thank you, everyone. And like she said, give us a call if you have any questions.
Take care. Have a good night.